The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally. A lack of B12 damages the myelin sheath that surrounds and protects your nerves. Without this protection, nerves cease to function properly, and conditions such as peripheral neuropathy occur. Even B12 deficiency that is relatively mild may affect the nervous system and the proper functioning of the brain. Protect your nervous system with AOR's methyl B12, available in 5 mg and 15 mg doses. Get yours today at your local retailer or online at aor.ca. Welcome to Supplementing Health. Regular physical activity is an important part of overall health. With an increase in activity comes a risk of injury and potential neuropathy, which is exactly what we'll be discussing today with Dr. Tracy Teasdale, naturopathic doctor. Tracy is passionate about health, wellness, and physical activity. She loves running, cycling, competing in triathlons, and paddling. And she utilizes this passion in her practice to help her patients find their own appetite for healthy living. Welcome, Tracy. Thanks for joining me today.
Thank you so much for having me. I'm really happy to be here.
So for the listeners who might not know, how would you explain what peripheral neuropathy is?
Yeah, so I think the first thing to consider is that so neuropathy is a damage or dysfunction of one or more of the nerves that can result in numbness, tingling, some muscle weakness, and some pain in the affected area. The thing to consider is that the nervous system is made up of two main parts. There's a central nervous system and the peripheral nervous system. So the central nervous system is the brain and the spinal cord, and the peripheral nervous system is the nervous system that innervates the rest of the body. So peripheral is, arms, legs, abdomen, anything that is outside of the spinal column itself.
And so neuropathy will appear in different stages depending on when your injury happened or what the cause was. Is that correct?
Yeah. So the first stage, usually there's a handful of stages. The first one's normally presenting as numbness and pain. And so if it's sort of a chronic injury where it's not, an acute injury, I got, tackled in football and all of a sudden I have this pain. If it starts more insidious or just sort of coming on its own, you start off with some numbness and pain in the area. Things just kind of feel a bit off. But it may be intermittent, and there may be some challenges with like balance or reflexes or things like that. And then the next stage is kind of constant pain. So it goes from this intermittent to more of a constant pain. And then the next stage is it'll actually, the pain will intensify. So it'll feel significantly more uncomfortable for patients or athletes. And then the last stage is sort of complete loss of sensation and complete numbness. So it's really important, the earlier on you can identify these, the better, the easier they are to treat from a progression standpoint.
And so once you have damaged these nerves, is it possible for them to regain their full function?
This is one of our naturopathic favorite answers. Is it depends, right?
Yeah.
So nerves, I know it depends on the person, depends on the injury, it depends on the presentation, etc. But if you kind of catch them early on, or if it's a minor injury, then oftentimes nerves will regenerate quite quickly. And if it's there's a variety of different ways that like a neuropathy can present. So the number one most common way is actually called diabetic neuropathy. So that's when the nerves are impacted by increased blood sugar levels and decreased circulation. And so they actually start to degenerate and causing, more decreased circulation, more pain, more numbness, and then that can progress. So that one, if it's a systemic cause for the peripheral neuropathy, we really need to treat the cause. For an injury-based one, oftentimes it's more of an acute injury, so they'll, generally speaking, be able to repair themselves.
Okay, and so are a pinched nerve and neuropathy the same thing, or would they have similar symptoms?
Yes and no. So a peripheral neuropathy, again, is the damage or inflammation to peripheral nerves. A pinched nerve is what we call a radiculopathy, which basically means it's an issue within the central nervous system. So all the nerves in our body come out of the spinal cord through the spots between our spinal column and our vertebrae. And so the pinched nerve is kind of from the spinal column usually for patients, and then a peripheral neuropathy is something outside. Having said that, they can look pretty similar because anytime that you're pushing on a nerve or pressing on a nerve, or if there's inflammation, the nerves kind of react the same way in that like sharp numbness, tingling, decreased sensation and pain.
And if one nerve in an area is affected, will it affect its fellow nerves in that area of your body, or is that just the way that your brain perceives it?
Yeah, it's generally the way your brain perceives it. So nerves it's kind of like a highway, right? So if you think about like a superhighway, the spinal cord is like that. And then you have some like subsequent highways or smaller highways that kind of come off of that. And then you get like backcountry roads, right? So it depends on where the injury happens. So if the injury happens, on one of those like kind of side highways that's pretty big, anything kind of beyond that will be impacted. But if it's sort of towards the end of your journey or the end of the nerve's journey, then it's just sort of that last aspect of the nerve that is affected. Does that make sense?
Yeah, no, absolutely. And so you had mentioned that reduced balance is a common symptom of peripheral neuropathy. How does that neuropathy affect your balance? Like, what role does it play in this imbalance that occurs?
Yeah, for sure. So our nerves serve a variety of functions, and so we normally just think of them as. Actually, I don't know how people think about them. I'm, immensely interested in the nervous system and in pain sensations. So for me, I kind of nerd out on this stuff a little bit. So I'm not sure how the general public thinks about nerves, but I would think that, most of us think about them in terms of, like reflexes and sort of just controlling our body. And so if you think about like touching a hot stove, there's a signal that goes to your brain really quickly to tell you, hey, that's hot, remove your hand so that you're not going to be, not going to burn yourself. We also have other nerves that, those ones are just, pain, temperature, sensation. There's other ones that impact pain or that like chronic pain. And there's some other ones that are involved in sort of like understanding where our body is in space. And we call that proprioception. And that's nerve-based as well. So if you don't know where your body is in space and you can't connect, your feet on the ground to your brain and what direction you're in, or, if you're standing on 1 foot or 2 feet, or if there's uneven ground that you're walking on, that travels really, really quickly to your brain to let you know how to maintain your equilibrium. And so if there is a pressure on the nerve, it won't necessarily transmit that signal very well. So it can result in loss of balance and just like a reduced awareness of where your body and body parts are in space.
That's really interesting. So when you get pins and needles from your foot falling asleep or your arm falling asleep, is that also due to your nerves, and can it be part of neuropathy?
Yeah, so if your foot falls asleep, it's basically a stress or a strain on the nerve, and so it's just a short acute sensation in your nerves, and then the same thing happens too if I'm sure everyone listening has probably like hit their funny bone at some point, right? That's a nerve in your elbow, and it hurts, right? When that happens, it's not so funny, unfortunately. I'm not sure why they call it that. But it's the same thing, right? So that's just a short-term aggravation of the nerve. When you get pins and needles in your feet, it's the same kind of idea. It's just a little bit of a short-term stress that recovers really quickly, right? So that sort of shows you how resilient our nervous system can be. But the peripheral neuropathy, and when it becomes more clinically significant, people are sensing that more frequently, right? So you can get an idea of what patients or athletes with neuropathies feel like, because they have that funny bone feeling or that pins and needles feeling much more chronically.
And so then for someone who has suffered a sports-related injury, how common is it for them to actually end up experiencing peripheral neuropathy?
Yeah, it really depends on how the injury presents and kind of what happens, right? So anytime that there's an injury, nerves are often involved. If you think about, our nerves come from from our brain to our spinal cord, then they exit through little kind of holes through the vertebrae, and then they travel through different areas. They travel through like our hips and our shoulders, and then down our elbows. So anytime that there's a hyperextension or like increased mobility of that or hypermobility of that joint, it can stretch the nerves as well, and so it can be quite common for athletes to experience it. And then there's a few sports that actually will have an increased rate, just depending on either the risk of like acute sort of contact injury, and there's some that are more like repetitive overuse as well. So it can be quite common in certain sports for sure.
And what parts of the body are most likely to be affected?
Yeah, the hands and feet are the most common areas for sure, but it can appear anywhere.
So you had mentioned that like sports that have more repetitive actions have an increased risk of experiencing neuropathy. So repetitive microtraumas that occur in athletes, can they build up to create neuropathy then? And how can athletes prevent those when they're practicing their preferred sport?
Yeah, for sure. So again, it comes back to, what's causing the neuropathy. Is it an actual, damage and inflammation to the nerve itself, which it can be, or is it, something that is sort of pressing on the nerve or pushing on the nerve, and that can be oftentimes like, muscle imbalances or postural concerns as well. And so there's definitely things that athletes can do in terms of, making sure their form is correct, including lots of time for recovery after a training session. So a lot of times we think, the training sessions are really the most important part of progressing as an athlete, but we often forget about the recovery aspect. And so there's some things that we can do in terms of some, body work and, lots of hydration. There's some hydrotherapy things people can do at home to increase circulation and improve recovery. There's obviously nutrition as well. Yes, there's definitely lots of different ways that we can do that. And obviously the first thing is prevention too. So if it's a repetitive overuse, we want to look at how we're using that that limb, or a common one is cyclists will get neuropathy in their hands because of how they're positioned on the handlebars, right? So they'll get stressed on the nerve from pushing on the handlebars or holding on the handlebars for too long. And so for something like that, we want to look at, okay, how can we adjust a bike setup so that the pressure is reduced, or maybe we're having too much pressure on our hands because we don't have enough core strength to hold our body up on the bike. So, there is something to be said there for the prevention aspect as well. But it ends up being very sport specific for sure.
Okay, cool. And so when we were talking about balance, falls and stuff become more common the older you get. And so I was wondering if that also plays into neuropathy with age.
Yeah, so there's a few things that are going on with that question. It's a little bit more complex than, how, like, why do we fall when we get older? Why is it easier to fall when we get older? There's a couple of things. So the first one is we generally lose lean body mass as we get older. So I always blank on the stat, which drives me nuts. I wish I should tattoo it on my forehead or something so I don't forget. But it's a lot more than we would think per year. So I think it's like 3 to 6% per decade, but don't quote me on that. I'll have to get back to you. But we lose our lean body mass as we get older at a quite high rate if we're not actually making active steps to maintain it. And so with reduced strength, there's also reduced mobility and reduced motor coordination. So the way that our nerves and muscles talk to each other and the way that talks to our brain starts to deteriorate as well. So there's one aspect. And the second aspect is that as we get older, we also, well, clinically, our diet tends to decrease a little bit in terms of quality. So we're not necessarily getting as good nutrition as we were before. And the biggest one there is a vitamin called B12. And so vitamin B12 is really important in nerve system function. And as we get older, it just gets really harder for us to absorb it. So there's decrease in body mass, there's reduction in nerve health as well. And then our brain ages too, right? So it doesn't quite work as well as it used to either. So there's a couple of things at play.
Can supplementing the diet with protein and B12 and things like that as we age help to reduce those risks?
For sure. As we age, so I'll address protein first because that was the first one you mentioned, then we'll talk about B12. Protein, we tend to eat less of it as we get older, I see, and we also tend to develop something called leucine resistance. And so leucine is one of the amino acids that's in protein, and it's really important for stimulating our body to grow muscle or to repair muscle. And so as we get older, our body becomes a bit less sensitive to leucine, so we need more to create that same response. So when you're 70, you need way more leucine than you did when you were 20. Yet we tend to be eating less protein when we're 70. So that's a really important aspect in terms of maintaining that balance and coordination. The second part was the B12 itself. And so B12, it's a really cool vitamin. It does lots of really interesting things, especially with respect to nervous system function and energy and things like that. But it ends up being really finicky in how it gets absorbed. So we need to have enough stomach acid in our stomach to allow our body to release something called intrinsic factor. And then intrinsic factor then binds the B12, and that's how we absorb it. But as we get older, we make less intrinsic factor, and we also have less stomach acid. So then we're less able to absorb the B12. So oftentimes older patients and older athletes might benefit from a B12 supplement or possibly an injection as well. And the trick with those is that the sublingual ones are the ones that you kind of like, it's either a drop or a lozenge that you suck on. That'll bypass the whole like stomach acid intrinsic factor issue and just get absorbed either like right across the oral mucosa or an injection we can do right into a muscle. And the injections are fun because we can do them right around where the neuropathy might be presenting to.
And so what blood levels of B12 would you look for if you were doing testing to kind of assess if someone is adequately prepared to prevent those types of issues?
Yeah, I do test B12 frequently, and the issue with it is it's not a super sensitive marker. So oftentimes patients will, they'll be in the low end range, and it'll look like they're fine, but usually we like them to be in like the mid to high range of their blood levels. Depends on the lab that you have it done. So some Canadian labs and US labs use different values. So basically like you want to be kind of at least in the middle of the range, if not a little bit mid-high, if that makes sense.
Yeah, absolutely. And so are there other nutrients or vitamins that you would recommend to help patients with either the absorption of these different nutrients that they need or additional nutrients that help to prevent neuropathy?
Yeah, there's a few other nutrients and like nutraceuticals that can be really helpful in terms of nerve health and nerve regeneration. So I'll just kind of list off a couple real quick that are probably a little beyond the scope of the whole chat today, but omega-3s can be really, really fantastic for modulating inflammation. Curcumin's another really great natural anti-inflammatory, and it also has a bit of an affinity to the nervous system too, so it can help reduce that inflammation, which is great. Alpha-lipoic acid has shown a bit of research in terms of improving nerve regeneration a little bit more quickly. There's some other vitamins that a deficiency in them can result in neuropathies as well. So the most common one, aside from like B12, is B1 or thiamine. And then there's a few others that, again, can help a little bit. So acetyl L-carnitine and acetylcysteine can be helpful as well. There's a little bit of research behind those too. So usually like a comprehensive approach can be really, really helpful when patients and athletes are experiencing neuropathy and or wanting to kind of prevent it and keep their nervous system in tip-top shape.
And do neuropathy and like low-grade inflammation pretty much always go hand in hand, or can you have one without the other?
Generally speaking, when there's a bit of, if the neuropathy is from damage, there's usually inflammation associated with damage. And then if there can be dysfunction as well. So there's dysfunction can occur without inflammation, but it's probably likely in there as well. I don't have, MRI studies to confirm, but I would imagine that there's definitely some inflammation happening.
That makes sense. And then our mind is a pretty powerful tool. And obviously, when you're a high level athlete, your thought process is a huge part of your success. And it can help with so many things, right? Like modulating stress and your HPA axis and all of that. So is there a role in using things like meditation practices and mind mapping type tools with your patients to help them in managing the pain that comes with neuropathy?
100%. There's a couple different models of how we experience pain, and then the newer, it's not that new anymore, but it's newer and being more widely accepted. Research is kind of funny, right? We do research and then it takes about 10 years for us to put it into practice. So the research has been around for about 10 years and we're finally like talking about it more. And it's called the biopsychosocial model of pain, which just means that it's not just our nervous system or like the biology that can impact the way that we experience pain. There's also psychological factors and social factors. So we can definitely use the psychological aspect there in terms of like the mindfulness meditation. We can do things like visualization. So there's some studies showing if you like visualize your body, healing an injury, that you can recruit more white blood cells to the area to kind of clean up and improve repair. There's also another older theory, which is still fairly applicable, and it's called the gate control theory of pain. And so what that means is that our brain, if we were to understand and like really, if our brain was aware of every single nervous input that happened every second of every day, it would probably explode because it needs to know what the air temperature is, it needs to know where you are, it needs to know if your heart's beating, it needs to know what you're seeing, it needs to know what you're hearing, and like all of the things, right? And it would literally explode. So it has a way to kind of filter out the things that aren't that important, and just sort of, highlight the ones that are. And so what can open or close the ability of those signals to reach the brain are things like, anxiety and depression and those kinds of things. Thinking positive thoughts will like reduce the nervous system input to the brain and kind of calm everything down. Whereas if we're like more anxious, we feel pain more consistently. And there's a few other factors there as well. But I think there's definitely a huge role for the mindfulness kind of psychological support there for neuropathy too.
And what are some of the other tools that you use when treating patients suffering from neuropathy?
Yeah, I love using acupuncture. It's one of the main tools I use in my practice when I have patients in the office. There's some virtual care happening now too, so it's pretty hard to do acupuncture over the internet. But when I have patients in the office, acupuncture is my favorite way to roll. And it's because the reason that it works is that it actually can alter the way that our brain experiences those pain and those nervous system inputs as well. So it increases circulation to the area, which is really helpful. It releases local enkephalins and endorphins, which help to reduce inflammation and reduce pain. And there's a few other kind of like neurochemistry things that happen there as well. But long story short, it reduces inflammation, increases circulation, and it also alters the way that our brain will experience the pain. So it can be really helpful in terms of modulating it. And then sometimes we can do something really fun where we hook like electricity up to the needles. And then we can impact the nervous system that way too, by kind of confusing it a little bit by sending our own electrical impulse instead of the nervous one, or the one that originates in the nervous system. There's also some like scalp acupuncture points that can be really helpful for affecting the nervous system, or like the neurology or the somatic nerves as well.
Very cool. It's an interesting thing how the body all works together like that, right? Like all the little points in our body that can affect such a big system.
For sure.
Well, I really appreciate you taking the time to chat with me today. I think this is such an interesting topic, and I mean, I'm sure there's a lot more we could probably explore within this topic, but I think this has been a really great overview. If our listeners would like to work with you, how could they go about doing that?
Yeah, the two easiest ways to get a hold of me would be following me on Instagram. So my Instagram handle is Dr. Tracy ND, so DrTraceYND. And from there, there's a link tree where you can access my website and book a free consultation there. And then there's also Facebook. So it's just Dr. Tracy Teasdale ND on Facebook.
Fantastic. Well, thank you so much for taking the time to chat with me. I really appreciate it. And I think there was lots of great information in here for all of our listeners to utilize.
Great. Thanks so much for having me.
Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic or email us at marketing@aor.ca.